Hi, I'm Alex Rabranovich, your LACERS Health Benefits Director, and I wanted to take a few minutes to talk to you about our Medicare requirements. If you're turning age 65 soon, congratulations. You'll soon be eligible for Medicare. But what does that mean to you and your health benefits? Well, the Los Angeles Administrative Code requires that when you do turn age 65 or otherwise become eligible for Medicare, that you do enroll in Medicare. You need to do this not only to maintain your LACERS medical coverage, but also, more importantly, to maintain your medical subsidy. So it's really important you know what to do, and I'm here to help you with that. LACERS offers what we call senior plans, and these plans incorporate Medicare benefits, which help to keep our costs low. It's good for LACERS, but I think it's even better for our members. So when you turn 65, if you want to continue your medical coverage through LACERS and continue receiving a medical subsidy, not only do you need to enroll in Medicare, but you also need to enroll in one of our senior plans. So about 3 months before your 65th birthday, we'll send out a packet that has information about enrolling in Medicare, as well as explaining what your senior plan options are. So you'll want to look for that in the mail. There are 3 easy steps to fulfilling your LACERS Medicare requirements. Within 90 days of your 65th birthday, make an appointment at your local Social Security office or visit their website at www.ssa.gov to start the 3-step process. The first step is to enroll in Medicare Part B. Everyone is eligible for Medicare Part B, but there is a cost associated with it that you'll need to be prepared to assume. The second step is to enroll in Medicare Part A, but only if you're qualified to receive it at no cost. You will be eligible to receive it for free if you paid FICA taxes for at least 40 quarters or 10 years. If you were hired by the city on or after April 1st, 1986, you have been paying into Medicare. If you were hired before April 1st, 1986, then you will not be eligible for Medicare Part A through your city employment. But there are other ways that you might qualify. If you have previous work experience in the private sector or at another organization where you paid FICA taxes for at least 10 years, or if your spouse worked and paid FICA taxes for at least 10 years and is at least age 62, then you might qualify. Not sure? Look at your annual Social Security statement or contact Social Security directly. The third step is to enroll in Medicare Part D, which you will do when you enroll in a LACERS senior plan. Medicare Part D is integrated into our plans, and so when you enroll in our plan, you automatically enroll in Medicare Part D. So do not enroll in Medicare Part D outside of LACERS, otherwise it could jeopardize your coverage. If you live outside the zip code service areas of LACERS HMO plans or outside of California, then you're eligible for the Medical Premium Reimbursement Program. This program allows you to enroll in an individual medical plan and be reimbursed the premium cost up to your subsidy amount. When you become Medicare eligible, if you're unable to access a LACERS senior plan, then you'll want to enroll in a plan on your own. Just make sure it includes Medicare Part B, and if you can get it for free, Medicare Part A. You should also enroll in Medicare Part D, whether it's included in your medical plan or as a separate prescription drug plan. So let's review these steps one more time. Everybody must enroll in Medicare Part B. Only enroll in Medicare Part A if you can get it at no cost. And do not enroll in Medicare Part D outside of LACERS. So those are the 3 things you need to do. Now let's talk about a few things that you shouldn't do. When enrolling in Medicare, there are some things to avoid. First, do not use different names across agencies. Some people use different variations of their name with different organizations. For example, if your name is Anthony, you might be registered with one organization as Anthony, but as Tony with another. Whatever name you use when enrolling in Medicare, make sure LACERS has the same name on record, and if you need to update it with us, please do. If the names are different, it could cause trouble with your coverage down the line. Second, Do not enroll in another Medicare plan. You will receive a lot of advertisements about various Medicare plans, and they're all going to sound good. Your Medicare benefits can only be assigned to one plan, and that would be LACERS. If you enroll in another Medicare plan outside of LACERS, your Medicare benefits will be reassigned and you will lose your LACERS medical coverage. Before you enroll in anything Medicare related, call us to make sure that your benefits will not be jeopardized. Third, do not let your Medicare Part B premiums lapse. Make sure your monthly Medicare Part B premiums are paid regularly and on time. If you stop payments, you will lose your Medicare Part B coverage, which will cause you to lose your LACERS medical subsidy and possibly your LACERS coverage. Also, depending on how long you go without Medicare coverage, you may be assessed a lifetime penalty when you re-enroll in Medicare. Fourth, those who are classified as having high income will be assessed additional premium costs for their Medicare Parts B and D. These additional costs are called Income-Related Monthly Adjustment Amounts, or IRMAs. Do not lapse on these payments either, as doing so will eventually result in the loss of your Medicare and LACERS coverage. For 2020, you will be assessed IRMAs if your taxable income is $87,000 or more if you file single, or $174,000 or more if you file jointly. LACERS will need to see proof of your Medicare coverage. So once you receive your entitlement letter from Social Security or your Medicare card, go ahead and make a copy of it and submit it to LACERS along with your senior plan enrollment form. There are a few more things you'll want to know about LACERS Medicare requirements. Retired members enrolled in both Medicare Parts A and B and enrolled in a LACERS senior plan or participating in the medical premium reimbursement program are reimbursed the cost of their Medicare Part B basic premium each month. This reimbursement does not include any IRMAs or penalties that you may have been assessed by Medicare, and it's only available to the retired member. It is not available to dependents or survivors. The reason why LACERS reimburses the Medicare Part B basic premium to those members enrolled in Medicare Part A is that when you are enrolled in Medicare Part A, the cost of our premiums drops significantly. So this is a way to encourage continued enrollment in Medicare Part A. Now, if you're enrolled in only Medicare Part B, your medical subsidy is going to stay the same. However, if you are enrolled in Medicare Parts A and B, the subsidy formula does change, so you'll want to be aware of that. And then depending on your Medicare status and where you live, you will have a choice of LACERS senior plans offered through Kaiser Permanente, Anthem Blue Cross, United Healthcare, and SCAN. You can find more information about your medical subsidy and health plan options in LACERS Health Benefits Guide. If you don't have a copy handy, you can find it on our website at www.lacers.org. Once you get to our homepage, click on the Retirees tab, and then click on Health Benefits. You'll be taken to a page and you'll find the link for the Health Benefits Guide in the left column. If you have trouble accessing the Health Benefits Guide on our website, just go ahead and contact us and request a copy. If you have any questions along the way, please feel free to call us. We're always here to help. Thank you and have a lovely day.